So, what do you do if you're in a surgery and you have a nurse who is not providing you with what you feel you should be getting as far as care goes? This has happened to me multiple times. I've had 44 surgeries, and my most recent experience was I had a total knee replacement, and there was some really amazing nurses there, and they were really on top of everything. They were also spread pretty thin. I think they were short staffed, but then I had some that were not so great. And I would request, you have to request your pain medication because they don't just automatically give that to you, which is kind of weird to me because they had just obviously done a total knee replacement. So I was unaware of that. But, anyways, I request my pain medication, and 6 hours later, I'm in full pain mode, and they do what's called a breakthrough pain medication. So I requested the breakthrough pain medication, and this specific nurse was like, well, we can't do that. And I said, you need to talk to my doctor about that because it is in my in the instructions that if I need to have my pain under control. At that point, my blood pressure was like 180 over. It was like 111, so it was like really really high because I was in so much pain, and I was getting super frustrated. My husband was getting super frustrated because these nurses just were not taking it serious that when I ask for pain medication, it means I need it. Like, I need it now. Now, to all you nurses out there, I freaking adore you, and I am so grateful for what you do. I do need to say, though, that when a patient is dealing with such severe pain, and you guys, if a nurse is not able to get to them in time, that breakthrough pain medication is not just a luxury, it is a necessity. For those of us who are dealing with this incredible pain. So this one particular nurse, she just did not want to do it for me. And so I just looked at her and I said, could I please have your name? And she said, no. And I said, I would like a new nurse. This is not okay. And yeah, I was in the moment, I was furious, and I was trying so hard to be nice, but it's one of those situations where when you're hurting and you are trying to communicate, and that's difficult because I tend to not want to hurt people's feelings. But having an experience like that, I walked away feeling like the only way to truly to connect with the nurses and like let them into what I'm feeling and what I'm dealing with is to be direct. And I would encourage you guys to definitely self advocate. And if someone gives you flack, you just say, you need to talk to my doctor because it's written in my care procedures. Like, if you're going to go against what my doctor's telling me, then you need to like talk with him because like I shouldn't have to be dealing with this. Like, I'm already dealing with they just did a total knee replacement. So anyways, I just want to say out there, first of all, thank you, nurses, for all you do. You're amazing. I see you. I know that you're often overworked, and there is a real struggle sometimes being understaffed, and I totally understand that. I had some of the most amazing nurses who were, very apologetic. It would take sometimes, 2 and 3 hours after I had requested pain medication, and they were always so sweet, and they were like, let's get your breakthrough pain medication so we can get on top of this because you do play catch up. And when you're in that much pain and it's making your blood pressure go super high, and you're literally shaking and tears are falling down your face, and to have a nurse that will look at you and say, I'm sorry, but I can't give you your breakthrough pain medication because you need to like be, I don't even know. I think it was like a power thing, a control thing. I honestly don't know why she didn't want to give it to me. But it was wildly frustrating and incredibly disrespectful. It was disrespectful to me, disrespectful to my doctor, disrespectful to the hospital. Maybe she was having a bad day, and for that, I get that. Like, we all have bad days, but I think in any situation, you cannot project what you're feeling on to the people, especially people that you're taking care of, because they can only do so much. And I certainly couldn't go and get my medications myself. It was a crazy situation. So, bottom line, the reason I'm making this is because you guys need to advocate for yourself if you're struggling, and that goes without saying in every aspect of life. Like, you be your best advocate, you be your best friend, you champion yourself, because there are people out there who are dealing with other things, but there are people out there who can be very cruel and just mean, and um, don't really care. They, some people, it was obvious that they were there just for the paycheck. They didn't really care about the patients. But then there was other people who were really amazing, who definitely cared about the patients, and that translates. Like, you see it, and it's interesting because this month is June, and it's PTSD awareness, and I do have PTSD, um, but I also, in PTSD, like, I have medical PTSD along with that, and um, situations like that just really contribute to um, the intensity of that PTSD. The anxiety, and I should never, as a patient, you should never feel like you're scared to ask for something that you are supposed to be getting or receiving, and the care that you're supposed to be, you know, receiving, which is kind of common sense. Um, you should never have to, feel that way. And the fact that she wouldn't give me her name kind of was an indicator that she understood she was doing something she shouldn't have done. And I don't know that she liked that I was very vocal about it and just said, I want somebody different, and I'm sorry, but you're not doing your job, and I need you to go get somebody who will do their job, because I need somebody who will take care of the things that I cannot take care of. So, anyways, champion yourself, guys. And that goes without saying. Everything in life, champion yourself, and um, also be kind. Just be kind. It goes a long ways. Those nurses who took care of me and helped me and encouraged me. I mean, like, I'm gonna get emotional thinking about it, because there's been so many times when I was just really struggling, and they were there and they helped me. And then there's the ones that just poured salt into the wounds, and you make a difference. You just really need to know that. So, anyways, yeah, sorry. I apologize. Anyways, have a great day. See ya.